Everyone. It's an honor to be here. I was very flattered when Dr. Verma asked me to give this talk. I actually gave this talk at the American College of Surgeons meeting in San Francisco last year. And it was interesting because we had a room that was about 4 times the size of this room, and it was standing room only. It was completely packed. So this is something that's really garnering a lot of attention, particularly in the United States. So I have no financial interest to disclose related to this talk. So burnout is, physician burnout is something that is within a spectrum of disorders that starts off with work-related stress and often eventually leads to depression. It is, however, very, very important to understand that burnout and depression are two very distinctive disorders. And it's important to make sure that we differentiate the two related concepts, okay? So the definition of burnout is when someone experiences a triad of things. One is emotional exhaustion, depersonalization that leads to reduced empathy, and a reduced sense of self-efficacy, or so the feeling that you're not really accomplishing anything. So burnout in India is not well studied based on my research, but there was a study conducted by Pranav Modi and Amit Garpur in 2012 that looked at 7,200 physicians and found that about 45.8% of physicians in India showed at least one symptom of burnout. They also found that physicians in India tended to have a 10% increased level of burnout compared to the general population, and about 17% of them showed increased levels of dissatisfaction. So when we did, there's a lot of research that's been done on US physicians and surgeons, and when they studied the habits of US surgeons in a multivariate analysis looking at about 7,200 surgeons, they found that the factors related to lower risk of burnout included the male gender, surgeons who placed a greater emphasis on finding meaning in their work, those who focused on what is important in life and embraced a philosophy of work-life integration. Now, taking that a step further and looking at factors that were associated with a high quality of life, that included maintaining regular exercise, talking with family, significant others, and friends, and having a good support system, protecting time away from work, and having recreational hobbies and activities. So not only were those factors reduced with consistent with a lower rate of burnout, but it was also associated with a higher quality of life. So what interventions work? Well, the data is complex, and the results are inconsistent and conflicting. But there was a meta-analysis done on a review of systemic reviews, and they found that most of the studies were done on non-homogeneous populations. So they were looking at students, residents, attendings, different groups of physicians, when in reality, the rates of burnout are very different among those populations. And physicians are not equally susceptible to it. There are factors such as age, gender, specialty, and marital status that play a role. They did find that physicians who are more experienced tended to respond better to interventions than those who are inexperienced, and it also mattered what type of healthcare system someone was in. So basically, further research is needed, but there is a lot out there now. So one study looked at actually training physicians to recognize the symptoms of burnout, and the study showed that simply understanding and recognizing the symptoms of burnout and getting some limited training, even if it's on an online course, actually helped reduce burnout. So simply being aware of the problem can be helpful. So Tate Shanafelt, who is a physician with the Mayo Clinic, who's done a lot of research on burnout, looked at the concept of finding meaning in work. And what he found was very interesting. Being passionate about work was associated with lower incidence of burnout, and that's pretty intuitive. I think most people can agree with that. But what he found was that the amount of time spent on doing your most meaningful activity was strongly associated with burnout. So for every 1% increase in time that an individual spends doing something that means something to them was associated with a lower risk of burnout. And what was also interesting is that a ceiling effect was noted at 20% of time. So basically leading to the 80-20 rule, which is individuals are usually willing to spend 80% of their time doing whatever their bosses and their leaders want them to do, provided that they're able to spend 20% of their time doing what they're passionate about. So there's also the concept of resilience. And resilience is the capacity for someone to recover quickly from difficult situations. So there are various types of practices that can be done to lead to greater resilience. Much of it is personality-based. Some people are just more resilient than others, but there are things you can do to help yourself. You know, leaving some time for self-reflection, for example, creating some time for yourself, self-compassion, taking it easy on yourself if you were to have a very bad complication in surgery, and then having a sense of spirituality, whether that comes in the form of religion, prayer, or meditation, or mindfulness, stress reduction. Interestingly enough, mindfulness-based stress reduction, which is a course that a lot of physicians are taking, is actually one intervention that's been shown to reduce burnout in controlled clinical trials. And then having some useful attitudes, such as being present, you know, giving patients and others your full attention and being in the moment, having a sense of acceptance and flexibility, having a sense of self-awareness and being open to self-growth, meaning being open to feedback from colleagues and from friends, is very important in terms of building resilience. So everyone talks about time, particularly surgeons, right? So we all say we don't have time for ourselves. We don't have time to put all these practices in place. Well, the perceived lack of time really does contribute to a sense of being overwhelmed for many people, and investing maybe in some time management strategies can also help to prioritize your work and restore that sense of control. So there is a book by Alison Rim called The Joy of Strategy, Business Plan for Life. And it's not a medical book in any way, it's a leadership book. And I didn't really love the book, but they did have some really interesting tools that you can try to look at time management strategies. But she had these matrices that she put together for setting goals, you know, and applying some degree of importance versus urgency, so that's a matrix that you can do for setting goals. And then there's another matrix that can look at the risk. It's called the risk-reward matrix, looking at something that's low risk or high risk versus being highly rewarding or low sense of reward. So if you merge those two, you can sort of help prioritize your projects and help with, you know, give you a sense of control over your time. So something, for example, you know, and I just used examples of myself here, something that I consider to be high reward that takes little time for me to do, for example, seeing patients and operating, preparing a talk, exercising. That's something that I find to be highly rewarding, but doesn't take as much time. I enjoy cooking, so for me that's highly rewarding. It doesn't take me much time, so I do it. Something that I do not feel is rewarding and I feel like takes a lot of time includes doing clerical work or cleaning my house, so I put that on my not to do list. And then something, for example, that is highly rewarding that takes up a lot of time is something you just have to evaluate the effort required. So, for example, taking a leadership course or writing a paper or writing a grant can take a lot of time, but if it's something you find highly rewarding, it might be something considered worth doing. So then there's the concept of self-care. And as I had alluded in my last slide, people who participate in self-care tend to have lower risks of burnout. And what does that look like? Well, that could mean maintaining regular exercise, including aerobic exercise and weight resistance training. And while that may seem intuitive, people who set aside time not only have lower risk of burnout, but they also have been known to have a higher quality of life. Physicians who saw their primary care physicians within the last year, these are people who care about their own health, so they make time to see a primary care physician. They tend to have a lower risk of burnout. Participating in self-care can help reduce stress. If you feel like you don't have enough time to participate in self-care, then, you know, maybe we all need to be thinking about how much we're working and if it's really worth sacrificing your own health to be, you know, and increasing your risk of burnout. So maybe we should all consider working a little bit less. And the other thing to think about is looking at what gives us joy. Really identifying what we enjoy can be really, really important to improving our quality of life and reducing the risk of burnout. As we become, you know, busier and busier in our practices, we tend to give up the little things that really give us joy. So, for example, giving patients your full attention, can help bring back that joy at work, that if you have lost that joy of seeing patients. Building a community and gathering with colleagues, having that sense of a peer group at work can be very important. And then, what do you enjoy doing at home? For me, it's playing the piano, practicing, you know, watching a movie with my kids, playing tennis. And then finding ways to reduce barriers. Ask yourself, am I working to the highest level of my training? And if you're doing things in your job that are not to the highest level of your training, then perhaps we should delegate those things. But in summary, there are lots of studies out there talking about burnout. They're numerous. Sometimes the results can be inconsistent and conflicting. There's not much longitudinal data on individual solutions, but there is a lot out there now. Things like finding meaning in work, building more resilience, maybe implementing some time management strategies, and participating in self-care and really identifying what you find to be joyful can be very helpful. Thank you.
Excellent talk, Dr. Manju. Dr.